Next, Rwanda says it's tightening screening on its border with the Democratic Republic of Congo because of a deadly outbreak of the Ebola virus. Comes as at least 80 people are thought to have died, many of them in 3 areas across the north of the country. A first case has also now been confirmed in the city of Goma, close to the border with Rwanda. World Health Organization has declared this Ebola outbreak a public health emergency of international concern. Let's speak to Thomas Mukwana now, who's following the stories from Nairobi. Thomas, good to see you. We've been following these developments, and it seems to get increasingly precarious there.
Yeah, you're right, Louis. The Congolese government and the WHO have not updated us on the figures of people who are suspected to have the virus. That still stands at 246. And people who have so far passed away from the virus, that stands at around 90 people. But the concern is overnight that there was a case that was recorded in Goma, which is in the border between the border of DRC and Rwanda. It's a very big city, and a lot of people go there. And one case of a woman who traveled from the epicenter of this current outbreak from Mintoo province all the way to Goma was recorded with the disease. Now, the problem is Goma is not under the Congolese government's control, which will bring up the bigger issue of conflict in this region. That will make it harder for humanitarian organizations to get into these areas and help people and try and curb the spread of this virus, because M23, a rebel movement that is backed by Rwanda allegedly, is present in Goma. They're the ones issuing the updates there. Kinshasa, one case was said to be there by WHO, but results of tests later say that it was a misreporting. And in the eastern side of the epicenter of this current outbreak in Ituri province, that's not even under, parts of that region are not under the Congolese government's control. It's under a jihadist movement called ADF. So humanitarian organizations might have to face the problem of navigating within Congo to curb the spread of this virus because of how disjointed the leadership is.
Given all those logistical and governance problems, what can actually be done when the system is working to try and stop the spread?
Firstly, the WHO, as soon as it declared this an international concern, it sent over $500,000 worth of emergency funding to respond to this crisis. Organizations like Doctors Without Borders and other NGOs present around East Africa also responded by sending their experts over. But more importantly, countries around DRC. DRC has 9 borders with different countries. A border with Uganda and a border with South Sudan are at the center of this current outbreak because Ituri province is near those 2 borders. Now, further in Kenya, the government of Kenya has tightened surveillance for the disease and also border checks and ports of entries at airports and near the border with Uganda. The Ugandan government that is directly involved in this crisis, because one case was reported there after a death from Ebola. That government has also announced the postponement of an annual pilgrimage, because apparently a lot of Congolese citizens travel over to Uganda for that event. The president of Uganda postponed that. South Sudan is on high alert as well, same as Tanzania. They've tightened border controls. And Rwanda, which has also seen a case right across the border into DRC in Goma, they've also tightened controls. And according to some reports, the Rwandese government has restricted movement into the country. So that's the first line of defense for all these countries, to try and control who gets into the country, try and do temperature checks before anyone crosses into the border, and hope that this doesn't cross over. If this crosses over, the catastrophe could be massive. The last time a big Ebola outbreak broke in West Africa, it caused over 11,000 deaths.
Thomas, thank you for that.